Group sex, often referred to as consensual non-monogamy or polyamory, has been a subject of fascination, debate, and scrutiny across various disciplines, including medicine, psychology, and sociology. The medical perspective on group sex encompasses numerous angles, including sexual health, mental health implications, ethical considerations, and the social dynamics involved. To understand the multifaceted nature of group sex, it's imperative to analyze the risks and benefits, societal perceptions, and the potential impact on individuals and communities. One of the primary considerations from a medical standpoint is sexual health. Engaging in group sex can introduce various risks associated with sexually transmitted infections, STIs. The more partners involved in a sexual encounter, the higher the potential for STI transmission. The Center for Disease Control and Prevention, CDC, has consistently emphasized the importance of practicing safe sex, particularly in scenarios where multiple partners are involved. Barriers, such as condoms, play a crucial role in reducing the risk of STIs. Education about STIs is paramount. While many may be aware of common infections like chlamydia and gonorrhea, others, such as syphilis, herpes, and human immunodeficiency virus, HIV, can also be transmitted during group sexual encounters. Regular screenings and open communication about sexual history and health status among participants are essential to minimize the spread of infections. The importance of these practices cannot be understated, as many individuals may hesitate to disclose their sexual health status due to fear of stigma or judgment. Additionally, access to vaccinations can play a pivotal role in promoting sexual health within group sex contexts. Vaccines for human papillomavirus, HPV, and hepatitis B can significantly reduce the risk of virus transmission during sexual encounters. Healthcare providers should advocate for routine vaccinations and educate their patients on the benefits of these preventive measures. Beyond the physical implications of group sex lies the psychological and emotional dimensions. Engaging in group sex can elicit a mix of feelings, ranging from exhilaration to anxiety. For some, the experience can enhance intimacy and connection with others, while for others, it may lead to feelings of insecurity or jealousy. Psychological well-being is closely tied to one's comfort level with group dynamics and the nature of the relationships involved. Those who engage in group sex often report high levels of sexual satisfaction, enhanced personal freedom, and a broader perspective on intimacy. However, it is crucial to acknowledge the potential mental health risks associated with group sex. A lack of emotional preparedness or unresolved issues from past relationships can complicate the experience. Individuals may grapple with feelings of inadequacy or comparison, especially if they believe their partners are more desirable or skilled. Therefore, mental health support and counseling can play a crucial role in facilitating positive group sex experiences. Therapists or sexual health educators can help individuals explore their feelings, boundaries, and communication skills in the context of group dynamics. The ethical dimensions of group sex also warrant attention. Consent is the cornerstone of any sexual encounter, but group settings add layers of complexity. All individuals involved must enthusiastically consent, which necessitates clear communication and a shared understanding of boundaries. The concept of affirmative consent, from verbal agreements to non-verbal cues, is particularly vital in group sex scenarios. Healthcare providers can play an important role in educating individuals about consent and ensuring they understand its significance in maintaining a respectful and safe environment. Family planning and reproductive health considerations are also essential in the context of group sex. Participants must be aware of contraceptive methods to prevent unintended pregnancies and be informed about their options, such as condoms, intrauterine devices, IUDs, and hormonal methods. Open dialogues about birth control and reproductive choices should be encouraged among partners, as shared responsibility can help mitigate conflicts. Societal perceptions of group sex can influence individuals' willingness to explore such dynamics. Cultural norms and values surrounding monogamy and traditional relationships often shape attitudes toward group sex. Many still view group sex as taboo, leading to stigma and discrimination against those who engage in it. Medical professionals have a responsibility to promote a non-judgmental approach to sexual diversity and to provide inclusive care that respects individuals' choices and identities. By fostering open discussions around group sex, healthcare providers can contribute to destigmatizing sexual exploration and help their patients embrace a more holistic understanding of sexuality. The rise of technology and social media has also transformed how individuals engage in group sex. Online platforms have created opportunities for people to connect with like-minded individuals, leading to the formation of communities that celebrate consensual non-monogamy. However, the digital realm comes with its own complications, including potential exploitation, deception, and a lack of safety measures. Medical professionals must be aware of how technology impacts sexual behavior and the increasing prevalence of online dating and hookup culture. Importantly, the implications of group sex extend beyond individuals to broader community health. Addressing the needs of diverse populations within healthcare settings is paramount. Marginalized communities often face barriers to accessing sexual health services and may experience higher rates of STIs. Tailoring healthcare approaches to be inclusive and culturally sensitive can help improve health equity. Outreach programs that specifically target at-risk groups can facilitate better awareness regarding safe sex practices and offer relevant resources and testing. Moreover, understanding the role of group sex within the context of healthy relationships is vital. Research suggests that non-monogamous relationships can be founded on trust, respect, and open communication, qualities that enhance the overall relationship quality. While some may associate group sex with chaos or emotional instability, many find that establishing clear agreements fosters deeper connections and mutual satisfaction. This perspective emphasizes the importance of examining both the relationship dynamics and individual motivations for engaging in group sex. Support networks, such as community organizations focused on sexual health or LGBTQ+ advocacy groups, can provide vital resources, education, and access to services for individuals interested in or currently participating in group sex. Engaging with peers who share similar values and experiences can empower individuals and encourage them to prioritize their sexual health and emotional well-being. Medical professionals should stay informed about emerging trends related to group sex and the evolving landscape of sexual health. Ongoing education and training in sexual health and non-monogamous relationships can equip healthcare providers to address the unique challenges faced by individuals engaging in group sex. This knowledge can help combat misinformation and stigma, ultimately leading to more effective and compassionate care. Additionally, considering the influence of intersectionality is crucial in addressing the experiences of individuals who engage with group sex. Factors such as gender, race, socioeconomic status, and sexual orientation can interact to shape individuals' experiences and attitudes toward group sex. For instance, individuals from marginalized communities may face increased scrutiny and discrimination, influencing their willingness to seek out medical care or discuss their sexual practices openly. Recognizing and addressing these disparities can lead to more equitable healthcare practices and resources tailored to diverse populations. In conclusion, the medical perspective on group sex is complex and multifaceted, encompassing sexual health, mental health, consent, and societal perceptions. Engaging in group sex presents both opportunities and challenges, necessitating thorough education, open communication, and a commitment to health and safety. By fostering an understanding of the benefits and risks associated with group sex, medical professionals can empower individuals to engage in consensual and fulfilling sexual experiences while prioritizing their physical and emotional well-being. As society continues to expand its understanding of sexual diversity, embracing non-judgmental and inclusive approaches will be key in ensuring that all individuals have access to the information and support necessary for a healthy and fulfilling sexual life. Group sex, a topic often veiled in controversy, provokes distinct reactions across varying religious perspectives. In examining this multifaceted issue, one must consider not only the theological doctrines but also the cultural contexts and interpretations that shape the views of different faith communities. Fundamental to these discussions is the understanding that sexuality plays a significant role in human relationships, morality, and spiritual beliefs. In many religious traditions, sexuality is considered a sacred gift, meant to be experienced within specific boundaries. For numerous faiths, this boundary is typically defined as the union between a husband and wife, ensuring that sexual expressions are directly linked to the procreative and unitive purposes of marriage. In this perspective, group sex may be viewed as a deviation from divine intent. Christianity, Judaism, and Islam, among others, often emphasize monogamy and sexual relations confined to marriage as a foundation for moral living and societal stability. Within Christianity, various denominations approach sexuality and group dynamics within relationships diversely. Traditional views, especially those within Catholicism and conservative Protestant circles, maintain a clear boundary around sexual ethics. The Bible, as interpreted in these traditions, often cites passages that uphold the sanctity of marriage and the expectation of sexual fidelity. Many Christians would cite texts such as Hebrews 13:4, which underscores the importance of maintaining marriage sanctity, as grounds to oppose group sex. The overall sentiment is one of promoting sexual relations as a profound expression of love between committed partners, which group sex may undermine by opening the possibility of emotional detachment and promiscuity. Conversely, there are progressive Christian communities that may adopt a more fluid interpretation of sexuality, particularly in the context of consent and mutual respect among participants. These communities might engage in discussions regarding the ethical implications of consensual non-monogamy, asserting that as long as individuals are respectful of one another and communicate openly, alternative expressions of sexuality can be acceptable. However, this stance remains controversial and far from universally accepted, often leading to intense theological debates within the faith. These discussions can sometimes reflect broader social changes, as notions of identity and personal fulfillment gain prominence in contemporary discourse. Jewish perspectives on group sex are equally diverse, shaped by centuries of rabbinic interpretation and cultural practices. Traditional Judaism, particularly Orthodox Judaism, typically emphasizes sexual relations within the confines of marriage. The concept of kedusha, or sanctity, in sexual relationships is pivotal. Sexual acts are seen not solely as physical but as a deep spiritual connection between partners. Rabbinic texts often clarify that sexual expressions outside the framework of marriage, including group sex, are discouraged. They are perceived as detracting from the spiritual and emotional depth that is supposed to characterize intimate relationships. However, Within more progressive branches of Judaism, such as Reform and Reconstructionist communities, there's a greater emphasis on individual rights and interpretations of the Torah. These groups might approach the subject of sexuality with an understanding that personal experiences and relationships vary widely. Conversations around the ethics of group sex may arise, with emphasis on consent, healthy communication, and mutual desire. Although these discussions might not lead to universal approval, they reflect a dynamic engagement with long-standing traditions. Here, the conversation can also intersect with the contemporary understanding of gender and sexuality, which continues to evolve within the broader Jewish community. When exploring Islamic perspectives, one finds that interpretations of group sex are similarly complex. Islamic theology places high importance on marriage as the legitimate context for sexual expression, reiterating that relationships are determined not just by physical interaction but by spiritual and emotional commitments. The Quran and Hadith emphasize the sanctity of marriage, and sexual relations outside this covenant, including group sex, are generally viewed as sinful. The concept of ilah, or divine love, amplifies the idea that sexual partnerships should deepen one's connection to God, which group dynamics could potentially disrupt. Nevertheless, one cannot overlook the existence of subcultures within the Muslim community that embrace more modern interpretations of sexuality. Some contemporary Muslim scholars and thinkers challenge traditional boundaries, arguing for the need to adapt Islamic teachings to align with current realities about love, consent, and sexual freedom. These voices often stress the importance of mutual respect and informed consent, presenting arguments that reflect a desire for a more compassionate understanding of sexual relationships while wrestling with the intricacies of religious adherence. The intersections of sexuality and religious beliefs also play a significant role in how group sex is perceived within smaller faith communities, including various spiritual practices, neo-pagan groups, and even New Age beliefs. For many modern spiritual movements, sexuality might be celebrated as a vital expression of life energy. Here, the emphasis typically centers on empowerment, consent, and the exploration of personal sexual identity. In such contexts, group dynamics might not only be accepted but actively encouraged as a means of fostering community, intimacy, and expressions of love that transcend traditional boundaries. It is vital to recognize that even within these groups, there exists a diversity of opinions about the appropriateness and ethics of group sexual encounters. Cultural factors also play an essential role in shaping how various faith traditions engage with and interpret sexual practices, including group sex. Societies influenced by traditions of individualism may be more accepting of diverse sexual expressions, while collectivist cultures might hold more rigid views, often prioritizing communal values over individual desires. These cultural norms can shape the discourse within religious communities and lead to different levels of acceptance regarding group sex. In certain cultures, sexual liberation movements have influenced religious thought, challenging established beliefs about sexuality. Leading to dialogues that connect faith with contemporary social justice perspectives, various progressive religious groups might adopt more inclusive attitudes towards sexual minorities and practices that had previously been stigmatized. These changes symbolize a growing recognition that faith communities are not monolithic but are instead composed of individuals with diverse experiences and perspectives. One cannot discuss group sex without acknowledging ethical considerations, particularly surrounding consent, power dynamics, and emotional health. In any context, religious or secular, the principles of informed consent, mutual respect, and open communication are crucial. These principles align closely with the core values of many religious teachings emphasizing love, respect, and responsibility toward one another. Thus, Irrespective of the specific religious perspective, the ethical implications of any sexual practice necessitate dialogue that goes beyond mere condemnation or acceptance. The portrayal of group sex in popular media also influences public perceptions and religious responses to the topic. Films, literature, and online platforms often challenge traditional norms, presenting group sex in various lights, both positive and negative. Such representation can incite fear, excitement, or curiosity, impacting how individuals within religious communities grapple with their beliefs. As debates continue in both secular and religious contexts, it becomes apparent that knowledge and open dialogue are essential in addressing the complexities inherent in the discussions around sexuality. Across various faith traditions, one sees that there is not a singular, straightforward answer to the question of group sex. The topic elicits nuanced perspectives shaped by historical, socio-cultural, and personal contexts. Emerging conversations in faith communities recognize the shifting landscape of sexuality, pressing for dialogues that encompass the evolving understanding of relationships and sexual ethics. This ongoing discourse highlights the importance of nuanced exploration beyond dogmatic views. As society continues to evolve, so too do understandings of sexuality and relationships, challenging faith communities to reflect on their teachings and consider how they engage with the lived realities of their members. The balance between tradition and modernity often prompts profound theological discussions, compelling religious leaders and adherents to confront difficult questions surrounding intimacy, desire, and spiritual life. In conclusion, the variations in religious perspectives surrounding group sex serve to illustrate broader themes in human sexuality and spirituality. As religious communities navigate these complex issues, they must strive to understand the intersection of human experience, ethical responsibility, and sacred teachings. By engaging in compassionate discourse, fostering respect for diversity, and recognizing the importance of consent, faith communities can embrace conversations about sexuality that not only honor their traditions but also acknowledge the realities facing individuals today. As the exploration of sexuality continues to evolve, fostering a culture of empathy, respect, and understanding will remain vital in bridging the gaps between diverse beliefs and experiences.